Hello, and welcome to the Postpartum Years podcast. I am your host, Dr. Ellen Kramp. I am a physical therapist and a pelvic health specialist. Joining me today is Dr. Kellie Soltis. She is also a physical therapist and pelvic health specialist. So welcome, Kellie.
Thank you for having me.
You are very welcome. Thank you for joining us.
Of course.
All right. So today we are going to be talking about breastfeeding, which is something that you wouldn't normally expect pelvic PTs to be talking about. But we each kind of do our own thing as far as helping women with breastfeeding. Kellie does something specifically called the Thompson method. So Kellie, tell us what that is and what we should know about it.
Sure. So the Thompson method is a little bit of a different approach to breastfeeding. It was founded by Dr. Robin Thompson. She's from Australia. She's a midwife. And she really developed the method because she saw over many, many clients that she worked with that a lot of clients coming from the hospital that she was seeing in home for follow-up sessions were really struggling with breastfeeding. A lot of it being having pain with breastfeeding, but some having issues with supply or fussy babies or other things like that. And a lot of her home birth clients really weren't having those issues, and she really wanted to know why. And so she did lots and lots of years of research, was awarded a PhD for her research and all of that. And what came out of it was the Thompson method. And so I talk about the main differences between like a traditional lactation approach versus the Thompson method is that traditionally, lactation will do like an asymmetrical latch. So we hear a lot of like nose to nipple things, or nipple to nose, things like that. The Thompson method does a symmetrical latch. So we talk about lips over nipple. And it just is another way to approach it that works for some people, where when the asymmetrical latch and the cross cradle hold and those types of things aren't working, this is another thing to try that can really help with pain and other supply issues. There's a lot of education on just how breast milk is produced and how your body works with baby's body and all of that stuff too.
Yeah, because I see a lot with breastfeeding issues in my practice, because I work closely with some lactation consultants, and it's not very common in the PT population, because I know you're working with women who are having issues with mastitis as well.
Mm-hmm. Yes.
So there's a lot that we can do for women who are having mastitis before it hits that infectious side where they need antibiotics. So if we can catch them early enough, we can treat the breast to usually, not always, prevent it from becoming an infection and needing antibiotics. So tell us what you do as far as that aspect of things.
We're starting to see some of those symptoms. We talk a lot about how to make sure that they are moving milk through the ducts at every feed. So I tend to see a lot of people who either are getting like clogged ducts or they're only feeding on one side every feed. And if we're just not getting enough milk flow through the ducts at every feed, then that raises the risk of clogs and things happening. Oftentimes I'm educating women on doing some what we call gentle compression for their breasts. So rather than having to like pump and try to get rid of the clog that way, or like, oh, baby's not really feeding that well, and so like I'm getting clogs and things like that, we talk about doing just some gentle compression to their breasts with the palms of their hands. And that often will get a letdown and kind of start and just get some milk flowing through, so that we can work on just clearing any of that clog out or anything that's causing some of those issues. And then we talk a lot about why baby might be having trouble latching. So is it because there's a really fast flow and they're pulling off and they're kind of clamping down and trying to control that? That's a lot of times the issue, especially early postpartum. When before supplies regulated and things like that, I see that a lot. Sometimes it's that other like oral devices were introduced really early. So when there's been nipple shields or things like that because of pain, or using bottles and things like that, then babies acting differently at the breast because breast tissue versus a more shaped thing like a nipple shield or a bottle that aren't going to be as pliable in their mouth, then it's harder for them to be able to use those things differently. And so oftentimes then they're not latching and drawing the way that we would want them to at the breast because they've gotten accustomed to doing it a different way with the nipple shield or the bottle or something.
Does the Thompson method work with the baby as well? If they're having like a lot of issues with shoulder tension, neck tension, just from their position in the uterus, does the Thompson method work with the infant in those circumstances?
So from my training through the Thompson method, not specifically, like we will look at those things. A lot of times I'll see babies who are like feeding well on one side, but not the other. And so then I've done like from then the PT perspective, like I've worked in early intervention and stuff before. So we can do some work on like, if we think there's a little bit of a torticollis or something like that. Mm-hmm. And then if that's not enough and the education of that isn't enough, then oftentimes, and with the Thompson method, they encourage referring out. So we'll refer to someone who does craniosacral therapy or a pediatric chiropractor or something like that to do some body work if needed.
With what I've been doing with breast and infant care, I had worked with a mutual friend of ours, Kat. She's the IBCLC. We had worked on different patients together where she would say, especially when we first got started together, I've got this baby who can't, do this or can't do that. And I'm like, well, you realize you can just kind of grab the lip and work on this kind of mobility. Or she's like, what? Like, oh, the tongue isn't moving. There's, you can work in the tissues, below the jaw, or you can work in the mouth and different tissues. Because I also do craniosacral therapy in addition to like a lot of other stuff. So I had worked with her on, a lot of stuff that can be done with the infant because they're often the cause of what's going on with the breast. And then a lot of stuff that can be done with the breast. I've sworn times where I want to do a study on soccer players, women who had like done a lot of soccer when they were younger, especially as their breasts were developing, because there's just so much restriction in the connective tissue within the breasts themselves that they tend to develop crazy mastitis just so chronically because of all of the restrictions that they have. So if you're a soccer player out there, come see me because when you're having trouble with mastitis, I want to do a research study.
It's fascinating.
Yeah. I love seeing the different methods that are out there, and there's not much from a PT perspective. And one of my missions in life is to get the pelvic PTs to take care of the boobs, because ortho PTs are not going to touch boobs. No. And if we're not afraid to touch vaginas, we're not afraid to touch boobs.
Oh, yeah.
So ortho just like doesn't want to get near anything like that. So, and if we're going to do breast care, we should really kind of start doing the newborn care, because it's a package deal.
Oh, yeah, for
usually.
Sure.
Yeah, I mean, you mentioned like a pediatric chiropractor, and it's probably much easier to refer to a pediatric chiropractor or somebody who does craniosacral versus getting them into a pediatric PT facility, which is going to be like 9 months down the road, which is way too late. Yeah, because I know the pediatric facilities that I've seen ever near me, it's always like a ridiculously long wait to get in. Yeah. Check out craniosacral therapy, check out, myofascial person who does infants, or pediatric chiropractor, something like that, to, for those infants that are struggling to feed. Are you aware of many IBCLCs that do Thompson method as well? Or is
There are
that
a few.
mostly? Okay.
There are a few who have done both trainings, and I think kind of utilize a combination of things. I think there's no one right way to do things, right? Like different things work for different people. So having, the knowledge and being able to take parts from different things. I've had people come who really have a lot of pain, but they feel a lot more comfortable doing the cross cradle hold, and it's pain once babies come on, or it's they don't have pain but they have issues with the fast flow, and so we're like doing a lot of education on that. And so it's like, well, I'm not going to change, even though we teach a cradle hold and a symmetrical latch. Like if the other thing is working for you and it's not painful and we're just working on the other components, then like that's fine. It doesn't have to be all or nothing. So
I like the multifaceted approach.
Yeah.
It's like, how many tools are in this bag? It's like, I will find one.
All the tools.
All the tools. I need all the tools. I need all the tools. We need more tools for the boobs.
That's right. And it's, I only got into this because of my own personal journey. So even a lot of pelvic PTs don't know a lot of this stuff. There's just not a lot of ways to get the education and stuff like that. And had I not dealt with it myself, I probably would have never even found it and done that education to begin with. So.
And for those that are struggling out there, there is help. So, whether you're looking for a craniosacral therapist or, if it's breast care in particular, IBCLC or massage therapist or chiropractor, they can sometimes help as well. And on the infant side, make sure that they're, somebody who does prenatal postpartum stuff. That's the important thing if you're looking for a practitioner out there, because I wouldn't want to go to typically, a hospital-based PT for, any sort of prenatal postpartum unless they had specifically a true prenatal postpartum program and not somebody who went to like one weekend course and, the hospital's trying to say, we have a program now.
Yeah. For sure. There's a lot more that goes into it.
Yeah. Because you don't want that, the ortho PT who isn't quite interested and they threw her into it. And even in the chiropractic realm, similarly, you don't want somebody who's like really sports oriented. Yeah. You want somebody, look for the prenatal postpartum chiropractor, because there are plenty of those out there. Even acupuncture can be really, really helpful. To get acupuncture, the herbs, but also, again, make sure it's somebody who's really focused on the women's health aspect.
Yeah, I think it's important to just know that there is help out there, that there are practitioners who do this, because I see so many people who are like, as soon as they struggle, it's like they were just told like, well, you just can't breastfeed anymore. Or like, oh, just use formula or just, do this. And it's like, and I mean, luckily they, the people that find me have been those people who are like, no, there's got to be a better way. Like there's got to be someone here who can help me. And so thankfully they find me through that, but it's really disheartening to hear how often they're told either by family members or by a lot of times just by their pediatrician, like, well, here, just use the formula, just use formula. And they're like, but I want to breastfeed. There's a lot of issues around not letting women trust their instincts with things. And we've made everything so medicalized. And so many people come and like, well, they're on a lower percentage curve. And I'm like, yeah, and you're 5 feet tall. Like they're going to be they're not going to be in the 90th percentile. You and your husband are not in the 90th percentile, like genetics. And just those, those types of things. It's like, everybody needs to be above the 50th percentile. And it's like, well, no, that's not how bell curves work. Like if we wouldn't have percentiles if everybody was the same. Right. Like, Or, I always see people that are so worried about, well, if I'm breastfeeding, like, how do I know they're getting enough? Like, well, are they gaining weight? Are they having wet and dirty diapers as they should? Like, those are all the things that tell you. And it's like so many times, like, they're like, yeah, well, that's all fine. And it's like, okay, well, yeah, like baby's growing. They're happy. They're acting like they're supposed to. Like, why is your pediatrician concerned about and pushing formula? They're on their curve.
Yeah.
There's nothing to be concerned about. And it's just like, and, I see so many women who are just like, oh, okay, like I felt it was okay, but then I'm being told it's not. And it's like, why are we doing that to people? So.
Yeah. In that case you alluded to earlier, mom's only 5 feet tall. So why do you expect the baby to be 50th? Yeah. I had that exact case where mom and dad, I don't think either of them were 5 feet tall. And the baby was like 10th percentile, but it was like this perfectly happy, almost, I wouldn't say chubby, but like nice little plump baby that was 10th percentile height and weight. But looking at mom and dad, that they fit that profile very well.
Tracks.
And yeah, like, what are you all not understanding? Like, your baby's perfect. Like,
yeah.
And it's obviously your baby.
Right. It's going to be tiny. You're tiny. And that's okay.
Yeah.
Like,
yeah.
The other thing that really bothers me is when, with the pain aspect of things with breastfeeding, is that so many women are told, like, oh, well, you just have to toughen up, or like, it's just going to hurt for a while, or like, just push through it, and those kinds of things. And knowing that, like, no, it shouldn't be painful is very important. Because I feel like with my first, that's what I was told. Like, I was in tears feeding him. And it was like, oh, well, you just got to toughen, your nipples just have to toughen up. And I'm like, really? How have we survived as a human race? If that's the case, right? And then with my second one, I found the Thompson method and just made some small adjustments in how my positioning was and things like that. And it was like, oh my gosh, it doesn't hurt.
Yeah. I need to share this with people.
Right. That was why I did the whole academy and why I do this now. And it's just like, oh my gosh, like, it's possible. Like, you can make those changes, and you don't have to suffer. It shouldn't be a horrible experience.
We just need to make that a mantra for physical therapy in general. You don't need to suffer.
Yes, the amount of times I hear no pain, no gain. It's like, no, that's not how it works.
Yeah.
If you're struggling if you're concerned about pain or supply issues, or feel like you're working with a provider, whether it be your own provider, your pediatrician, or something, who is not hearing your concerns and not letting you be the guide of things, and your baby best, and even though they're the medical professional, like, they're there to educate you and help you make those decisions, but finding someone who's really gonna to listen to your concerns and hear what you want for yourself and your baby is super important, and we are out there.
Yeah. And the only thing I would add to that is, if you are struggling to feed that baby, yes, please continue to try if that's what you want, but at the same time, make sure the baby is getting enough food. So it is okay to supplement, whether it be with donor milk or whatever in the meantime. But, until you do get that help, make sure the baby is getting enough food.
Yeah, absolutely.
Caveat, because it's like, yeah, okay, it's okay to want to breastfeed, and that's your passion, and work with your IBCLC to keep your milk supply, or try to increase your milk supply, whatever needs to be done. Work with an IBCLC. If you don't agree with the one you're working with, try another one. Yeah. But the number one thing is that baby needs to be fed. So however that needs to happen, and until you find that provider that can help you, just make sure the baby gets adequate intake, however that looks.
There's help no matter what that journey looks like.
Yeah.
For you. So
yeah. All right. We hope you found that helpful, and we shall see you next time on the Postpartum Years podcast. Thanks.